This is the Average Joe PT channel. We're here, we talk about reducing your pain, a little bit of humor, a little bit of education, and a little bit of fun to hopefully brighten up your day a little bit. Now, after the last channel talking about the back, today I said we maybe might talk about the knee a little bit. And that's what we're going to do. We're going to talk about the knee, some reasons why you might have some pain. But like always, if your pain doesn't seem to go away, all right, doesn't seem to come and go, you need to follow up with your doctor, all right? This channel is here just for a little bit of extra information so you don't have to kind of get thickened through the internet to try and figure out what's really going on, all right? And so that's what this purpose is about today. Today we're going to talk about Mr. or Mrs. Knee. So stay tuned. Here we go. All right, we're back. And so, like always, I want to get everybody on the same page and discuss the anatomy a little bit. Not a lot. This is the Average Joe channel, all right? Average Joe PT. And I'm here to give you just some information. I don't want to bore you to death, but at least want to give you an idea. What's this thing? Why are you even having some pain in that knee? All right, some basic causes. So today we're going to talk about some arthritis in the knee, all right, and maybe some tendonitis or bursitis of the knee. All right, so the first things we're looking at here, all right, I'm going to zoom in a little bit on us so you can get a better view. This thing right out here, this thing over the top is called the quadriceps tendon. And so quad in Latin means four, all right? It's four muscles that kind of run down and along your hip and thigh and kind of come and attach to this long tendon. Now this long tendon comes all the way down and kind of attaches to this kneecap, all right? Or what we call your patella. And that's got little grooves in it. All right, kind of sits in kind of a sleeve, this kneecap does. And it kind of moves up and down depending on if you're bending or straightening, whether you're flexing or extending your knee. And so after that tendon comes all the way down after at the bottom or the apex of the kneecap, it comes down and attaches to the bone. So this is kind of a tendinous ligament area, more ligament, all right? And then up here is more tendon as the muscles come down and run here, all right? And so that gives you an idea of maybe you're having some tendonitis of the tendon on top. A lot of times after a knee replacement, all right, they have some pain up in this area and give them a little bit of a tendonitis after being stretched and pulled and banged on from having a major surgery. Or maybe you're just having a little bit of quad weakness, some thigh weakness that's really stressing that tendon or the ligament and give you some pain, all right? And so if we look at just the tendonitis component of it, there's a lot of tendons that run on either side, all right, of the knee, kind of come over the top. And also if we look on the back side, two main groups, you have your what we call your calf muscle or your gastrocnemius muscle that runs over the top to the femur bone, and also your hamstring muscles that are four of them that come all the way down and run and attach to the other side around the front and around the back. And they help actually flex your knee. Now this knee really does two things, all right? It bends and straightens, and it does a little bit of rotational movement too, some pivoting. Don't want to do a whole lot because you end up blowing one of the ligaments out if it ends up causing some sort of trauma to the knee, maybe from the side, or you fall and you twist, you pop the meniscus or a tear one of the ACL or what we call the medial collateral ligament or MCL, all right? And so that's what they call a terrible triad if you tear all three. But, so if we look at, some tendons that can run down on the side that can give you some pain. Now, you might give you a diagnosis of both tendonitis and bursitis. Now, what the heck is bursitis? I tell people that the bursa basically, when they're not inflamed, they're really thin, almost like tissue paper. Now, when they get swollen and inflamed, they kind of blow up and become a sac. And so that's when you're dealing with issues there. Now, the bursa actually run in between those tendons. So as the tendon comes down through, instead of the tendon rubbing on the bone, it's got a bursa there that kind of glides over. So that tendon's not really rubbing on anything but that nice bursa. And so if you have a tendonitis, a lot of times you get that bursa gets inflamed and you get bursitis with it. And so usually, wherever there's a tendon, there's usually a bursa with it. And around the whole knee, there's a ton of bursa, all right? And so because there's a lot of very long, tendons that come over the top of the knee. And anything that's very long and elongated like a tendon, it's very easy for it to get inflamed and irritated. So as you can see, the knee It's a very movable, very pliable joint, but unfortunately there's a cost to it, and some of it being tendonitis and bursitis, and some of it obviously being arthritis over time. And what type of arthritis are we talking about here is we're talking about osteoarthritis, okay? Not rheumatoid arthritis or psoriatic arthritis. If we want to talk about arthritis, we could talk about that in another discussion. You could just leave a comment down below, hopefully subscribing to my channel, all right, and ringing that bell so that you can see the content coming, and hopefully I can brighten up your day a little bit, give you a little bit of humor, and hopefully give you some information content that can help you throughout your day, or maybe help a family member or a friend. All right, hopefully get them to come to my channel. And so if we look at just some arthritis, some osteoarthritis is basically wearing of the cartilage on the joint. And so a lot of times what we're talking about is either the back of the kneecap, all right, or the top of the femur, and obviously the tibia too. Usually when you hear that little grindy, crunchy sensation as you bend up and down, that's usually the arthritis on the actual back of the kneecap rubbing against the femur. And now that's normal. It's called crepitus. If it's giving you pain, obviously you need to be treated for it. But if it's not inflamed, it's just making a weird noise and there's no pain involved with it, well, that's what happens as we get a little bit older. The cartilage starts to wear and thin out. Sometimes it bothers us, sometimes it doesn't. If it's bothering you, obviously see your physician or go see a physical therapist, like myself. But anyways, that's another type of arthritis, which is crepitus. So as time goes on, this cartilage, what we call hyaline cartilage, and there's different kinds of cartilage. In this case, hyaline cartilage that kind of lines the bone, thins out, and then obviously you could be irritating that. Now, one of the things that seems to cause arthritis in the knee, or accelerates it, is weight bearing. Unfortunately, if you weigh a little bit too much, all right, you're putting extra stress on the joint. And so, how much? The stat is this: for every 1 pound you're overweight, it's 4 pounds of pressure on this knee. And in the hip, it's 3 pounds of pressure. 1-to-3 ratio, or in the knee, as we're discussing today, is a 1-to-4 ratio. So yes, for instance, if you're having a knee replacement, the doctor sometimes might say, hey, unfortunately, we got to get you on some sort of registered dietitian or see a physical therapist, and they might put you in the pool to help reduce your weight so that you have a better recovery and a better outcome for your knee. So yes, unfortunately, there is some research that talks about if you weigh, unfortunately, too much, or you're just a bigger person by nature, you might wear down the cartilage a little bit thinner and a little bit thicker, and that also can cause you some pain. So there is some research and rationale. We're not just picking on people that unfortunately weigh a little bit more and they're having a little bit more pain. All right, and so they might come and see a physical therapist, and we might do some exercises, okay, whether it's osteoarthritis or some sort of tendon inflammation or bursa. All right, we might do some taping techniques, all right, to help maybe unload the tendon that we're going to kind of discuss a little bit today. We might give you some stretching exercises to do below and above the joint to maybe take some stress. We might talk about footwear. We might talk about, maybe you have what I call pancake feet, or pes planus, all right, which is flat feet. You might need to go see a podiatrist or an orthotist about getting some orthotics for your feet so that this affects the alignment a little bit different. Because if you look at your knee straight on, all right, and you have a flat foot, a lot of times your knee might dive inwards. All right, you see how it kind of goes in a little bit? It goes in a little bit on that side. That's called knock-kneed for the average Joe, or genuvalgum. All right, and if you like that a lot, and through the years, you can stress the cartilage in certain spots. All right, and that could come from your hips weakness. It could come from some stretching. So you see a physical therapist, they might point that out at you. So we might look at the knee, but we also are going to look at you as a whole person on that side and see exactly what can we do to reduce your pain, as well as hopefully reduce or attempt to eliminate the issue getting worse, whether it's a tendon problem or arthritis. All right, so it isn't just exercise. Like I said, we use all kinds of modalities to try and at least reduce your symptoms first so that we can actually do the exercises for your knee. All right, so that's two kind of ideas, some taping techniques. There's different kinds of tape. There's rock tape, there's kinesio tape that has different pretty colors to it and certain things. We might do some Macau tape, or also called Leuco tape. So there's a lot of different types of tapes out there, as well as techniques to help reduce this tendon issues or bursa issues while we try and improve your alignment and your strength above and below the knee joint. All right, so I think I'm going to show you a couple taping techniques that you might do at home, all right, and just give you some basic stretching and maybe a couple strengthening exercises for today, all right. As always, if this thing is inflamed or swollen, all right, and it don't seem to be helping in a few days, go see your doctor. Go maybe see an urgent care specialist that can give you a referral, all right, to a physical therapist, all right. So let's go ahead. We're going to come back. I'm going to show you some different techniques for taping and some strengthening. So stay right there. Get some popcorn, get some soda. I'll be right back, all right? Here we go. All right, we're back here. And so I'm going to show you two taping techniques, all right, for you can do. One for the just generalized arthritis and one for this patellar tendon or ligament giving you some pain, all right? So this is not a paid advertisement by any stretch of imagination for these in any type of tape, but I'm going to use the rigid kind of Leuco tape to kind of support the tissue, And so if this is itchy or scratchy when you get this tape, now you can buy this tape probably at any sporting goods store. You can obviously buy it off of online at any store too. But there's a cover roll to protect the skin, and then you have the brown rigid tape that goes over the top. All right. So when you're having this, making sure that your skin is not fragile. If you're an older person, all right, you're probably not going to want to do this if your skin seems to bruise easy, or if you're on some sort of anticoagulant, or what the layman average Joe says is blood thinners. All right, it doesn't really thin your blood, but that's another discussion. But anyways, but if you're having any of those types of issues, don't be doing this taping because you don't want to pull it off and actually tear your skin. But for the majority of people, this will be fine to at least try it for a few days and see if it reduces your pain. All right, so the first technique we're going to look at is if we looked across the joint line here, we're going to take the tape, the cover roll, and just gently lay it across. Don't have to pull it tight or anything. Just going to put a couple strips across the top of your knee, all right, and below the knee. All right, so then you're going to take, that's the cover roll, and then you're going to take the piece of tape, all right, and you're going to basically come into like U pattern. So you're going to kind of pull from either left to right, or we say medial to lateral or lateral to medial, but you're going to come down and you're going to kind of pull up, so it kind of lifts the joint up a little bit and the tendon to reduce pain. All right, that's one technique. Shouldn't be painful, might just feel a little bit of a tug, and that's basically it. You might put a couple strips of tape just across when you're kind of coming down in a downward pattern and you're kind of coming up, and the pull comes in an upward fashion to kind of lift that tendon. And as you can literally see as you lift that tendon up, it's naturally relaxing the quad and actually naturally unloading the ligament and the kneecap itself. And so that might help reduce the tendon and bursa and your arthritis inflammation just enough. Wearing it a few days straight, that might help get you over that hump so you can do some of these exercises that I'm going to show you. Now the second piece, the second technique, basically you just come across the actual ligament. No pulling up or nothing, just come across. You might see a runner use this like a strap that comes across with a foam on it. The fancy term is a strain counter strain strap. You get them for your elbows, basically any long tendon. And essentially what it's used for is to displace the stress off the tendon to a different part of the joint so that that tendon or ligament gets a little bit of relief from pain. So those are the two techniques I would recommend to see you try for taping. All right, so I'm going to show you a few exercises and then we'll go ahead and we'll finish up with this episode. All right, we're back. And so I'm going to show you a few exercises that you can do for your knee. All right, once you've iced it, you might have done the taping technique. All right, and so exercise number one, you're just going to lie down on your back. You're going to bring that knee up and just going to straighten that leg out. You're just going to work on the hamstrings, holding for 30 seconds to a minute. Those hamstrings cross the knee joint. Just a nice stretch. All right. This is good for your spine. It's a good hamstring stretch if you're trying to protect your back while you're stretching. There's all kinds of positions to stretch your hamstring. This is the most beneficial for supporting your spine while you're working on your hamstrings, okay? So you kind of get a 2-for-1 deal. Your other leg is supporting your spine as well as your spine is being supported. Now you can do this in the bed. It's not as good as on the floor, but obviously if you have a knee pain and you can't get up from the floor, you can easily do this one in bed. All right, so you're just gonna straighten your knee, like I said, hold for 30 seconds to a minute, and then relax and rinse and repeat 2 or 3 times. All right, the second one you're gonna do, all right, you're just gonna cross the leg over and you're gonna pull this knee to the shoulder. That's a nice stretch for the hip on that side to kind of stretch out, especially if you're having pain along the side of the hip. All right, a lot of times the iliotibial band or the IT band that crosses the knee joint on the outside will also get inflamed, so this is a nice stretch for that. All right. Another exercise you're going to do, all right, is you're just going to lie here. You can do it in this position where the one leg's out straight, and you're just kind of lifting it up and down, hold for a second, and then relax. That's a good one for the quad. Now you can do it in this position, or you can lie down flat, all right, and do it with your leg out straight. And hold for a second. Don't go any higher than the opposite knee, and then come down. All right, you're not going to the ceiling. This is incorrect. All right, come up, pause. Nice contraction, nice tightening of the quad of the thigh, and then down and relax. All right, you're going to do about 15 or 20 of those. How many is enough? You should have fatigue. You should feel like it's tired a little bit just from exercising. Don't go by numbers, go by quality. All right, it's all about quality, not quantity. So you go to the muscle feels some fatigue, some tired, and then you're done with that. All right, come up, lift the leg up, pause, and then relax. The last one I have you do is lie on your side, okay? Keep that hip nice and tight. You're not sagging down. Nice and tight. Hold it in. Lift the leg up, okay? Lift the leg up, pause. Make sure it's in line. Ear, hip, ankle, all in line. Your leg's not in front of you, all right? You're using the muscles in the front if that's the case. We're kind of working the hip muscles in the back. That's what we want. Come up, pause like we did the other exercise. 1, 2, then come down, relax. And you rinse and repeat that. Like I said, you're going to feel fatigue in that muscle group, the gluteus medius. All right, that's what, call them the glutes, whatever you want. There's 3 muscles that make that up, but this is average Joe. We're just going to call them the glutes or the butt muscles. All right, so the last one I'm going to show you is called the step stretch or the calf stretch. Now you can do this with a towel. All right, put the towel around the foot and then just kind of pull the...
Apologies. I couldn't hear what you said.
Sorry about that. That's Siri. So you have a towel or sheet and pull it there and kind of feel the pull behind the knee, just a nice stretch, holding that for about 30 seconds and relaxing. Or you can stand, all right? I'm out of the picture a little bit. You can see my foot, all right? And if you have your foot on a step or open up your kitchen cabinet and put your foot inside the kitchen cabinet so you can hold on to the sink and kind of lean forwards while that foot is being supported on the step, you can get a good pull in the back of the leg and the same thing, all right? You should just feel a stretch. And with the strengthening ones, you should just feel a little fatigue. So we're going to finish up right now with this episode. Okay, so that's the exercises. That's some taping techniques that you can do. And like always, please subscribe down below. I'm going to keep bringing content to you. All right, put on the bell so you know that the stuff's coming to you. All right, until next time, I want you to look up and keep smiling.